This video is to demonstrate how to use the DT-1200 197501 from Zopec Medical. The DT-1200 is highly effective in helping patients with pain management and increasing local blood circulation to enhance healing. It was specifically designed for the treatment of peripheral neuropathy, back pain, sciatica, and joint pain. Let's start with your DT-1200 TENS and EMS multifunctional therapy device and assume you're ready to go with the batteries installed. Now connect two lead wires to the top of your device. They came with it. Put one in channel A and put the other one in channel B. Channel B is on the right when your unit is facing you. Alright, so that's how this should look. Now you want to take the two lead wires. Well, let me first talk about interferential treatment. The 1200 also delivers an interferential current. Let me explain by using these 4 2x4 adhesive pads. I've labeled these A and B, and now you can see how they are diagonally opposed, and when you maintain this pattern placement on your body, you will get that interferential surge, which really stirs things up and delivers a therapy different from most TENS and EMS on the market. So now let's go back to our lead wires and hook these up. What I want to do is I'm going to take the lead wire from channel A, the 2, and connect those to my A pads, like so. They can be a little stiff. Sometimes you have to push really hard, a little tight. And then take the other one from channel B and put those in your B pads. So, like so. They're all different, we talked about sciatica, back pain, shoulder pain. For demonstration purposes, I'm going to use my knee because it's the easiest thing. It's hard to get them on your back by yourself, and we don't have any systems today. So let's see. I'm going to show you how to slightly moisten these pads. They have a little more adhesion if you slightly moisten them. So right before you put the pad on, just moisten it like that lightly. And I'm going to put my 2 A pads on first and moisten. And this is the placement for the knee. If you'll go to your manual on pages 17 and 18, you will see placement for different areas. In fact, I will show that to you right now. So in your manual, you'll see placement on page 17 and 18. Right now we're doing the knee, so we're looking at that type of placement. Now I'm going to turn the unit on. So go to your 1200, open it up. And let's see, what we want to do is get to your channel A. Turn your unit on and go to channel A. And what you want to do is go down to the program. Let's see, let's try, depending on the area you're treating, you want to pick different programs. But we're going to start with program 2 on this one, so I'll channel down and get to where that's blinking, get that on number 2. And then also my B, I'm also going to put on to number 2. You want to have them on the same pattern, the same programmed, memorized program. And now what you want to do is toggle back up to where it says MA, that top flashing number, and start to get the power, ramp up that power till you start to feel stimulation. That MA refers to milliamps, but I just think of it as the power button because that's what it's doing. It's increasing the power. Increase it slowly the first few times you use the unit because it ramps up slowly. And you may suddenly kind of have a surge of stimulation as it's building. That's not good. So what you want to do the first few times is do it slowly. After a while, you'll know how high you can take it, and you can just start at that level right away, like if you're at 19 or whatever. Now you want to go ahead and do the same thing on the other side. So get that to the same program, and then raise your stimulation on that side as well. There we go. and you'll have your unit all set and programmed. Turn your timer on to 30 minutes. That's that button in the middle on the bottom. Get that up to 30. 25, 6, 7, 8, 9, 30. There we go. And do this 2 times a day for 2 weeks, and you should see improvement. And remember, there are other products and accessories that you can use with the DT-1200, like there's silver-coated pads for your feet, like these, and hand neuropathy as well. So talk to your clinician for any of these other items or for further information. And thanks for purchasing the Zopec Medical DT-1200.